Good morning, everyone. My name is Dr. Asawari Dabir from MIMSR Medical College, Latur, and my guide is Dr. Bhangdia, sir. This is a case of a radicular cyst. Introduction: a pathological cavity lined by epithelium containing either fluid or semi-fluid substance is termed as a cyst. The cyst associated with the teeth is called as an odontogenic cyst. The periapical cyst or radicular cyst is the most common odontogenic cyst which is seen, and it is accompanied or associated with a dead or non-vital tooth. The epicenter of this cyst is most commonly the apices of the involved non-vital tooth. These are inflammatory cysts, and most of them are small in size, but sometimes they can become large and they can invade the maxillary sinus. So this is a case where a 25-year-old male presented to the OPD with a chief complaint of painless swelling over the right cheek region. Over a period of 1 year, it gradually increased in size. On clinical examination, it was a firm, non-tender swelling, which had overlying normal skin. There was no local rise in temperature and no pain. And on intraoral findings, there were obliteration of the buccal vestibule and a root stump at first molar tooth. Then the patient was then underwent radiological investigations. So on X-ray PNS, it showed complete and diffuse haziness over the right maxillary region. The patient then underwent CT. It showed a large expansile lesion, lytic lesion involving the right superior alveolar process and a large cystic component which was invading the right maxillary sinus, causing a thinning of the maxillary sinus walls. The diagnosis based on the history and clinical findings was made as a dentigerous cyst, and the patient was then referred to the dental department. The patient underwent surgical enucleation, and the decayed tooth were extracted, and the retrograde filling of the premolars were also done. Then histopathological examination was done, and the diagnosis came out to be a radicular cyst. So discussion: the radicular cyst is an inflammatory odontogenic cyst seen at the root apex of the dead pulp. These cysts are most common among other odontogenic cysts because the incidence of pulpal pathology is quite common. So in this present case, the carious tooth was the prime cause of occurrence of the cyst. They are slow growing and may cause bony expansion as well. So in conclusion, the majority of cysts are small in size. They don't usually invade the maxillary sinus, but in cases where there is invasion, CT can help us to distinguish between the intrinsic and extrinsic origin of the cyst and further aid in the treatment of the patient. So this is a case of radicular cyst involving the maxillary sinus.
Which other cyst you know about? Why it is only a radicular cyst?
So because there was a presence of dental caries in the right molar, and the radicular cyst is associated with in a non-vital tooth, whereas dentigerous cyst, it occurs most commonly in unerupted teeth. So it was just a DD and not the diagnosis, ma'am.
If it is related to crown?
What are other differential diagnoses for this cyst?
So when the cyst is invading the sinus, the DDs would include mucosal and mucus retention cyst of the maxillary
sinus. That is in the
sinus.
sinus, in the jaw, in the maxillary bone. This is dentigerous cyst. If it is not dentigerous cyst, what other cyst you will found which are associated with these dental pathologies? You have to mention some differential diagnosis, no?
So dentigerous cyst one, then radicular cyst, which is the most common one. Then
so how will you differentiate between dentigerous and radicular cyst? Both are
so
different
dentigerous cyst, no, so dentigerous cyst is occurs in an unerupted tooth, sir, and radicular cyst occurs in a erupted tooth with caries or any dental pathology, sir.
So what are the features of the dentigerous cyst? How will you differentiate? That's what Madam is asking. Unerupted tooth, that is right. But you will find this radicular cyst around the apex.
Yes, sir.
And in the dentigerous cyst, there will be the crown.
Radicular cyst is periapical cyst.
So basically, a dentigerous cyst, when it's what you are trying to say is, whenever there is a dentigerous cyst, and if it gets secondarily infected, forms a caries in the tooth, does it become a radicular cyst?
No, sir.
So that is not what you are trying to say,
No,
right?
no.
That is what he was trying
No,
to know.
sir.
What about maxillary adenomas? Would you consider them as a differential here? Amyloblastomas, adenomas. Any malignant cysts you know of?
No.
Okay, fine.
I had some comment to make about your presentation. So I don't know what rules, regulations were there, but you have taken so much effort. I don't know on the printout whether it is readable, but you need to change the way you have made the presentation, because many of the things are not readable. So if your poster is there, you have taken so much effort, it should be something where it's presentable, readable, because when you want to win a prize,
Yes, sir.
अच्छा ऐसा है क्या? हाँ. It was, some things were also getting deleted. So you've taken so much effort. Whenever you
Well,
go for a prize
presently-
winning, they look at all these small things. So make it more nicer next time.
Should I display the other one?
Show. Last finish, last two होते दोनों. You should always show.
The poster display is vertical, but this was better. We should have shown this.
It's really nice, I'm telling you. All these things matter when you go for any bigger